Hello, I'm Dr. Jasmeet Bajaj, Medical Director of Critical Care at Penn Medicine, Princeton Medical Center. I'm board certified in critical care medicine, internal medicine, and sleep medicine. Today, I'm going to talk about what to expect when a loved one is admitted as a patient in Princeton Medical Center's intensive care unit, or ICU, a specialized unit where critically ill or injured patients are treated. Our ICU provides 24-hour on-site care by doctors known as intensivists, who are specially trained to treat patients in critical conditions. Hopefully, you or a loved one will never experience a medical condition that requires treatment in the ICU. But if this advanced level of care is needed, numerous studies show that patients whose care is managed by intensivists recover more quickly and achieve better clinical outcomes. It's a stressful time when someone is in the ICU, so it's only natural to forget to ask a question, or for a question to come up suddenly for the family or patient. At Princeton Medical Center, we are always available to answer questions anytime, day or night, and we encourage people to approach us with their questions or concerns. Patients are encouraged to participate as much as possible in decisions about their care. When a loved one is in the ICU, please keep these tips in mind. Ask before touching or moving anything around the patient. Ask first, but physical touch, quiet conversation, and even softly playing the patient's favorite music can be comforting. Improvise when needed. For example, give the patient a small writing pad and pen to write out messages if speaking is a problem. Make time for self-care by making time to eat and sleep, setting up a schedule so visitors take turns by the patient's bedside can make that possible. ICU physicians regularly communicate with the primary care doctor and any specialist working with the patient in order to coordinate care. And every day, doctors and nurses, as well as pharmacists, respiratory therapists, dietitians, palliative care experts, and social workers meet to review the medical status of each patient in their care, so everyone is up to date on each patient's condition and treatment plan. Most monitoring and treatment can take place at the bedside, including dialysis, diagnostic imaging, and even some heart and lung treatments. Palliative care to help develop a comfort care plan is also part of ICU care. If ICU treatment is needed, Princeton Medical Center's 24-bed Llura Gordon Gund Center for Critical Care focuses on caring for both the patient and their loved ones. The center provides 24-hour on-site patient care led by a team of intensivists who become the primary physicians for each patient during their time in the ICU. The intensivists oversee many decisions involved in a patient's care and consult with specialists such as cardiologists, nephrologists, and surgeons as needed. This enables us to manage the care of our patients and communicate seamlessly with patients and their loved ones. While life's critical moments cannot always be predicted or prevented, you can rest assured that you will have access to highly specialized care if and when it is needed the most.